specialist at the Los Angeles County Hospital. He has spent the last 4 years doing research on HPV and treating patients.
It's a pleasure to be here.
So Dr. Ty, what is HPV?
HPV is a sexually transmitted illness. It's one of the top, well, number one sexually transmitted illness in the United States according to the CDC. According to the CDC, there are 79 million people in the U.S. alone that are infected. 14 million every year get infected, so if you do the math, you'd see why we need to have people informed to get tested and to get vaccinated. We want people who are a little shy about and are a little unsure to get tested, because if you don't get tested, that HPV virus is going to get worse and worse and worse, and before you know it, you might be infecting the one person you love, and that beautiful night in the sky might become a nightmare for both parties involved.
Do you come across an abnormal pap smear? How do you treat it, and overall, how is HPV preventable?
Well, if you have an abnormal pap, you have to take consideration of the patient's age, their medical history, and also we have to check everything else and take into consideration, because in some cases this could also potentially lead to cervical cancer, and if it is cervical cancer, we could actually help treat it because it's one of the most preventable cancers in the world. As for treatment, for genital warts, it could be treated with medication, and also we have to treat it with a senior doctor in a timely manner. And that's pretty much it for treatment. For prevention, I think what we should do is we should have people here, like little Tommy, little Susie, get vaccinated. For boys, it's 11 to 12 years old. It's for 6 months, over a 6-month period, they have to take the shot 3 times, and that's called Gardasil. For women or little girls, like little Susie, it's 11 and 12 years old. At the same age, they take Cervarix and Gardasil. It's 6 shots. I mean, it's 3 shots over 6 months. And if they didn't take the shots earlier, for women, it's 16. It's like 21 to 26. Also, we recommend also men to also have Gardasil as well in their 20s, and also immunocompromised patients, those who have weak immune systems, so that they would be protected. And most importantly, if you're gonna have sex, we ask that they wear a condom. It will save a lot of heartache. It will save a lot of unnecessary pain, so that night in the sky will be a wonderful night.
Thank you, Dr. Ty, for joining us at our LACC news station.
Oh, the pleasure was mine.
We'll see you guys tomorrow at 7 with a special report from Dr. Ty's office.